Let's begin with an overview of the data. Last Friday, CDC reported 157,000 new cases of COVID-19. Our 7-day average is about 137,000 cases per day. This represents an increase of nearly 12% from the prior 7-day average. The 7-day average of hospital admissions is about 11,000 per day, similar to the previous 7-day period. And 7-day average of daily deaths have also increased to 739 per day, an increase of 23% from the previous 7-day period. As cases, hospitalizations, and deaths continue to rise, I want to re-emphasize the serious risk of COVID, especially to the unvaccinated, and the importance of vaccines to prevent severe illness and save lives. This slide shows data on hospitalizations among the vaccinated and unvaccinated reported to CDC's COVIDNet. This is a nationally representative sample of hospitals that covers approximately 10% of the US population. Based on these data, from January through July, represented on the horizontal axis, COVID-19 associated hospitalization rates were 17 times higher in unvaccinated, shown by the blue line, compared to vaccinated adults, shown by the green line. These data have been submitted to a preprint server and anticipate they will be posted online in the next few days. Additionally, today in CDC's MMWR, we published a report examining data from Los Angeles County between May and July, which found that people who were unvaccinated were nearly 5 times more likely to be infected and about 29 times more likely to be hospitalized with COVID compared with people who are vaccinated. These data remind us that if you are not yet vaccinated, you are among those highest at risk. The Delta variant of SARS-CoV-2 virus is highly transmissible, represents over 98% of COVID cases here in the United States, and is driving up infections, hospitalizations, and deaths across the country. Please do not underestimate the risk of serious consequences of this virus. Vaccines are the best tool we have to take charge of this pandemic. We continue to see more and more data on the safety and effectiveness of the vaccines authorized in the United States, and now we have full FDA approval for one vaccine and extraordinary safety and effectiveness data for the others. If you are unvaccinated and ready to revisit your decision to get vaccinated, or if you still have questions, talk to your physician or a trusted source to get the information you need to get vaccinated. Thank you. I'll now turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. I'd like to spend the next couple of minutes in addressing a much underutilized intervention for COVID-19, and that is the use of monoclonal antibodies for the treatment and prevention of SARS-CoV-2 infection and COVID-19 disease. Next slide. For those not totally familiar with this, monoclonal antibody is an antibody that's produced by a single clone of B cells or a cell line and consists of identical antibody molecules that can actually be produced in the in vitro situation in unlimited quantities. Next slide. If you look at the virion on the upper left part of the slide and you look up the blown up spike protein, the red molecule on the right upper panel, when you talk about polyclonal antibodies, which result from infection or vaccination, it's a group of antibodies against every aspect of the spike protein, which is the good news. However, the concentration and the affinity of those antibodies can be markedly improved if you get a single cloned antibody, hence the word monoclonal, that's against a very specific part of the spike protein that can have a major effect in prevention and treatment. Next slide. So let's look at what we have. We have 3 anti-SARS-CoV-2 monoclonal antibody products that have currently had emergency use authorization from the FDA. And the EUAs here are for adults and children 12 years of age and older who weigh at least 88 pounds. There are 3 of them. There's the Lilly product, the bamlanivimab plus etesevimab. There's the Regeneron product referred to as RegenCov. And then there's the GSK and Vir product. Each of these products targets the spike protein of SARS-CoV-2. Next slide. So you can do an indication for these antibodies that are twofold. The first is to treat infection with SARS-CoV-2. Next slide. And in this regard, clinical trials have demonstrated that early treatment with anti-SARS-CoV-2 monoclonal antibodies can reduce the risk of COVID-19 hospitalization or death by 70 to 85%. It is important to emphasize that this must be done early in infection and not wait, of course, until a person is sick enough to be hospitalized. That's when you get the best effect. And again, being an underutilized intervention, we want people out there, including physicians as well as potential patients, to realize the advantage of this very effective way of treating early infection. Next slide. Now, if you look at the people who should benefit from this is a list from the FDA and the NIH treatment guidelines about all of the people who may have significant benefit from this type of therapy if given early in their infection. I'm not going to go through each and every one of them, but as you can see, there are a number of conditions on this slide that could benefit from the monoclonal antibody treatment after infection. Next slide. But there's also the benefit of prevention using monoclonal antibodies. Next slide. And we know now that the FDA, just a couple of weeks ago, authorized the Regeneron monoclonal antibody for post-exposure prophylaxis, namely for the prevention of COVID-19 after someone has been exposed to a documented case of SARS-CoV-2. And even now, and I won't show the data because of lack of time, there are now studies in pre-exposure prophylaxis as well as other studies in treatment. So I'll have on the last slide, next slide, the treatment guidelines panel. We can give you all the information and it's accessible on the website shown here. And for physicians, patients, and others who want to know how you can get monoclonal antibodies administered, this is the call center, and this is the online way to approach it. So, bottom line is, this is a very effective intervention for COVID-19. It is underutilized, and we recommend strongly that we utilize this to its fullest. Back now to Vivek.